Uh, okay, thank you, sir. Thank you. Okay, now it is a time for the English session. Welcome everyone for today's session. Today is our 1771 1717th day of continuous webinar. Thank you all the participants for being with us, and thank you all the faculties for sharing your knowledge. And now let's begin our session with a silent prayer. Good evening and welcome everyone. Today's our guest is our host. As we say, we are changing the characters. Likewise, today's Dr. Hubert's role is as a guest. So Dr. Hubert have the 35 years of experience. He's running a clinic successfully in Karakutam, and he's a BHMS and a M.Sc in psychology, and he's a musician and IFPH moderator and taking care of IFPH channel, IFPH YouTube channel. And I'm welcoming Dr. Hubert for today's session. You're welcome, Doctor. Please.
Thank you, Doctor. Can you hear me?
Yes.
Okay. Very happy to see you all for this wonderful day. Let me share my screen.
Yes, sir. This is your family.
Yeah. Okay.
Yes, endocrinological disorders with homeopathy.
Last time we have gone through different parts. Now let us go to wording. This from scripture 1 James 3:5. Likewise, the tongue is a small part of the body, but it makes great boasts. Consider what a great forest is set on fire by a small spark. The tongue also is a fire, a world of evil among the parts of the body. It corrupts the whole person, sets the whole course of his life on fire, and it is itself set on fire by hell. Wording. Tongue. We all have a tongue. When we talk nicely with love, everybody will love us. What we saw, that will be read. So, whatever coming from our mouth makes a person, whether he is a good man or bad man. And there is a proverb in Malayalam, Mugam Manasinte Kannadi. The face is the inner person. That is the mirror of our inner part. What is me, that will see in my face. So we have to, whatever it is coming from our mouth, through our tongue, that is a small organ, very small organ. Like a captain controlling the ship, a big ship, with his both hands. That is how the tongue is also working in a person. If we allow a person too much, we may admire some person, but whenever he makes a false statement, that time we will abandon him. That is our what we do. So we should be careful. If a person is perfect in his tongue, that means that a person as a whole is a good person or a complete person. Many times We know that one of a great personality in our film field, Amitabh Bachchan. Once he lost everything. He was such a popular person at the same time, he lost all his wealth. At that time, how he made himself back. That was, he was, today I got a few days back, I saw a video in Rajinikanth, one of the great actor told that Amitabh Bachchan always goes he lost everything. He was seeking for a job. At last, he got it and he regained it. He restored it. So that is how we have to do what Hahnemann says, that we have to restore. The word, the restore means, it was a very wonderful word he used. The meaning of restoration of health, restoration of everything, what we have, what we lost through our tongue. Let us go. This is our tongue. How we are going to the hormonal activities on tongue, and let us go to the shape of the tongue and let us see where all this, how we can taste things. Sweet, the foremost area. Beside that, salty, sour feeling. Whenever we take a food, bitter, sweet and bitter, we can see that sweet is here and the bitter is the back part of the tongue. Sour, salt. Hormones produced in the tongue and other parts of the body affect taste, oral health, and appetite. Hormones produced in the tongue and other parts of the body affect taste, oral health, and appetite. Taste hormones in taste buds. We may think that small taste buds, but it produces hormones. Hormones like cholecystokinin, glucagon-like peptide 1, and neuropeptide Y are produced in the taste buds and may affect appetite and food choices. Everything in our body, some doctors may say that there is no need for a tonsils. Let it take it out. Sometimes they may take, whenever in the former time, whenever they open their abdomen, they will immediately take away the appendix. But every part of our body is important. You know that? Now we can see that the taste buds, they are producing hormones. These hormones are giving taste. Sometimes whenever we use some artificial teeth and gums, that time even the gums may have the power, the quality to, or the power to, it may give the taste. If there is no gums, the taste will be reduced. So every part of our mouth, everything in different parts of the mouth, we can also feel all this taste. That places of disaster, wherever it happened, tongue, lips, palate, gums, inside of cheeks, root of mouth. Places of disaster, tongue, lips, palate, gums, inside of cheeks, root of mouth. We never think that it is much important, the health of our tongue. If it is tasteless, what is our life? If we don't have eyes, We cannot see anything. What will be our life? We have all these things. So we don't know the value of each and every part of our body. So when we know that if there is an infection of fever, immediately it affects the throat. Tonsils may be affected, pharynx may be affected, and after that, it may come down, and it enters the different parts of the alimentary canal and as well as in the lungs, and it may affect. So tongue is much important. What hormone causes bad breath? There is some hormones are causes bad breath. This is due to the stress hormones cortisol, adrenaline, and noradrenaline. Together, these hormones can change the production of the bacteria, making your breath smell bad. There are so many things, foul smell from our mouth. Normally, our body will decay every time. The speed of the decaying may be racing on after ages coming up. A person having stress, this is due to stress hormones, cortisol, adrenaline, noradrenaline. Together, these hormones can change the production of the bacteria, making your breath smell bad. What are the medicines we are using for foul smell? Rampresa sir is watching seriously. So we have to think that, here the electricity loss gone. So what will happen? Now, let me do it. Now, when the another thing, tongue mapping. Mapping of tongue. Here we can see that the different parts of the tongue having action on heart, the foremost place of our tongue may affect the function of heart. Below that, just back, stomach, lungs. Lungs and tongue is related. Behind that, stomach. And then pancreas, liver, gallbladder, spleen, the middle part of the tongue, liver, gallbladder, spleen, affected. Then after that comes intestines, then bladder. From superior to downwards. From superior area to downwards of the body, our body, these are the areas where the tongue having relationship with the. So heart may be affected. Whenever we give digitalis or the tip of the tongue, it may get good result. Immediate result. Tip of the tongue. There are the tongues, we know that the different parts of the tongue having much actions. Whenever that medicines we are applying, the medicines, homeopathic medicines, we can use these parts. Immediately that result will get. The neurological effects and the hormonal effect will cover it. Adrenal cortical hormones, hydrocortisone and other adrenal cortical hormones affect the taste acuity. Tastelessness, we have so many medicines there is producing. Here, I got the current, electricity is gone. So how long, I don't know how long I can go. So these are sharpness, keenness, adrenal cortical hormones, hydrocorticones and other adrenal cortical hormones affect taste acuity. Sharpness, keenness, then thyroid gland, parathyroid gland and pituitary hormones. Deficiencies in these hormones can cause taste problems. Zinc, a zinc deficiency can cause taste buds to die. Taste buds to die. If the zinc deficiency is there is chances of death of taste buds and the hormones which produced by the taste buds and leading to a loss of taste. Can hormone affect the tongue? As the oral mucosa contains estrogen receptors, variations in the hormone levels directly affect the oral cavity. The principal peri- and postmenopausal oral symptoms are xerostomia, sensation of painful mouth, of numerous causes, and burning mouth syndrome. These are all seen in menopausal diseases. We know that menopausal syndromes, there is a vast subject, and these are all produced. The hormonal imbalance, burning mouth syndrome of ladies having in the menopausal time, there is chances, burning tongue, hot flushes, and lachesis is one of the medicine which is most useful, lachesis and acid nitricum. These are the two medicines, as well as graphite is also used for this condition, and at the same time, arsenic album, you should not forget arsenic album. These are the medicines for using burning mouth disorders. And phytolacca. Another, these are the different types of tongues, the mapping of tongues. Normal mouth is like this, tongue is like this. Stagnation, blood stagnation, deficiency, phlegm, and damp heat. There are Chinese yin deficiency, body fluid deficiency, bloodstream, blood stasis of blood, diminished blood supply, deficiency of body fluids deficiency. Here we can see that the tongue is blackened tongue. Damp heat, that is brittle tongue. We can see all these patients, whenever such patients are coming to our clinic, we can see different types of tongues. So we have to give much importance for to learn the tongue. Okay. Electricity come. Thank you. Oral health. Hormone during puberty. Hormones. Estrogen and progesterone can increase blood flow to the gums, making them more likely to bleed and swell. One of the major complaints of menopausal disease, menopausal syndrome is tongue, gums, gum bleed, deficiency of bleeding, the blood flow of the gums reducing, making them more likely to bleed and swell. Hormonal changes during menopause. Menopausal women may experience dry mouth, altered taste, and burning sensation. And in addition to that, if there is diabetic mellitus or diabetes insipidus, it may be aggravated, more aggravated. The symptoms may be more aggravated. So in conditions like this, natural moor is one of a good medicine, as well as the tissue remedy. They can use natural moor. Vitamin and mineral deficiencies, low iron and reduced B vitamins. Vitamin B can contribute to burning mouth syndrome. Burning mouth syndrome. Now we can see that various causations that cause causative factors, that is iron deficiency, low iron deficiency, and reduced vitamin B can contribute to burning mouth syndrome. So in cases, we can use ferrum force, ferromet, Singamet, acid nitricum, and Merck salt. We should not forget Merck salt. Merck bin iodide, the Merck group may be very much helpful in burning condition. And as well as, in addition to that, there is stiffness of joint. Stiffness of joint. Merck salt is a wonderful medicine for giving ladies in the times of menopausal. Burning tongue common symptoms. Dry mouth, sore mouth, itchy mouth, sticky mouth, a tingling or numb sensation the mouth or on the tip of the tongue. Tip of the tongue. First off, a metallic taste. What are the symptoms? Dry mouth, sore mouth, itchy mouth, sticky mouth, a tingling or numb sensation in the mouth or on the tip of the tongue, a metallic taste. Once a person came to my clinic, various taste, each and every time his taste may be changed here and then, changing the mouth. But he is having a very high blood pressure, more than 200. Systolic is more than 200 and the diastolic is more than 140. But I gave the doctors of allopathic medicines, they send him away, kick him away from their hospitals and also from medical colleges. And I treated him for within a few months. He got everything is okay. And I gave, these are the medicines that Natramur, calcareous carb, and Naxomica, nitric acid, and Merxol, and Merck bin iodide. These are the medicines which giving wonderful effects. What are the symptoms of a weak tongue? Symptoms of hypoglossal nerve disorders. Another part, nerve disorders. The tongue becomes weak on the affected side and eventually wastes away, atrophies. As a result, people have difficulty speaking, chewing, and swallowing. Tongue and neural problems may be there. A person, day before yesterday, came to a person having body pain, numbness of the. He is a worker and a contractor. He's doing heavy work. For several years, he was very much, he suffered a lot. His children always make massages before he going to sleep. Otherwise, he cannot sleep. 2-3 days back, he came to my clinic. And he treated years, but he is a very hardworking man. He was treated, but pain, always pain, 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 pain. So I asked him, they are doing allopathic treatment, Ayurvedic treatment, and Ayurvedic treatment he got some relief. And he can even turn his head here and there, and IBDP, intervertebral disc prolapse, and these are the conditions. So I told him on exercise for 2, I told him to raise his head and move like this. After taking the cases again and again, I asked him whether you have a fall or a hit on your back. He told me that once he fallen from a big tree in his childhood. So I took everything, the symptoms, I left every symptoms, and I gave arnica and Bellis perennis. Yesterday he came to me and that he told me that he got a great relief and he could sleep without doing his massages with his children. Every night he has to be massage for an half an hour, then only he can sleep. That's much pain, that's much numbness of his life. And all he told me that a great relief he got and he could sleep well. So we had to take the importance of taking cases, and the history of injury is very much. In some conditions, we had to give natrum salt, CM potency. I give it 2-3 times in a day, natrum salt, for head injury or any. That is the reason why he suffered a lot throughout his life. But no doctors asked him what is the reason. That is a causative reason. Causation is very much important because the history of injury, if there is a history of injury, we have to give, first we have to give the treatment for these are the medicines, valuable, very valuable medicines are arnica and Bellis perennis. What are the symptoms of a weak tongue? Symptoms of hypoglossal nerve disorders. The tongue became weak on the affected side and eventually wastes away, atrophies. Atrophies anywhere we may have. A patient may have atrophies of any part of our body. So we have to check the size of the part. A big heart, a small heart. What is the difference between a big heart and a small heart? A big heart is it a good one? Literally, a big heart is good. But physically, a good heart is bad. We may say that he has a very good heart, a big heart. That is literally good, but at the same time, physically, it is not good. Heart. So, atrophies anyone may have one type of mapped tongue. Is it like an Indian or American? Shaped like an American or a country? Which country? I don't know. You know? Can low estrogen cause burning tongue? Who is most at risk for burning mouth syndrome? Burning mouth is most common in postmenopausal people of over 60. That is because lower estrogen level cause decreased taste buds sensitivity. That is because lower estrogen level cause decreased taste buds sensitivity. The sensitivity of the taste buds. Which medicine? Which is very sensitive? Epasals? Epasals? Yeah, I lost. Okay. These are another type of tongues. Blood deficiency with heat. Blood and deficiency with heat. Blood and deficiency with heart heat. Oh, stomach deficiency with damp heat. There are different types of heat. Deficiency with heat, with heart heat, with damp heat, with excess heat. Stagnation, slight deficiency, turning into heat, stagnation, blood stagnation with heat, black tongue. Not Karinak. We may say that Karinak is different from black tongue. Due to deficiency of bloodstream, stagnation, we can see that the spots, maybe the black spots on the tongue. That is maybe due to deficiency or some deficiency or the stagnation of blood, petachia-like symptoms. And also we can see in the eyes, there is black spots, small black spots. If we see, that time also we can say that there is blood deficiency. Appetite. Hormones that control appetite. Cholecystokinin, glucagon-like peptide 1, and neuropeptide 5 are hormones that control appetite. What is the role of metabolic hormones in the taste buds of the tongue? Abstract. Gustation is one of the important chemical senses that guides the organism to identify nutrition while avoiding toxic. Which are the medicines we are using for loss of appetite? Important medicines for children: Sina, China, Nexomica. Then we can use alfalfa, the medicine, an appetizer. Loss of appetite due to problems of liver complaints, Lycopodium, phosphorus, and bryonia. Bryonia, Lycopodium, phosphorus, and also sulfur. Sulfur is an important medicine for tastelessness. If a man having some pain of the lower abdominal pain of the right lower abdomen, we may think that normally we may think about the other parts that McBurney or appendicitis or anything like that. But there are so many things. If there is a liver complaint, there may be chances of pain in the lower abdomen. If there is a problem in the ureter, any stone or some, that time the pain in right lower abdomen or the right part of the abdomen. Gas problems. It may be due to the production of bile, and there is deficiencies in the metabolism of fat metabolism as well as in carbohydrate metabolism. That time also there is chances of pain of the right side of the abdomen. In all these conditions, lycopodium is one of the important medicines. Lycopodium, China, and carbamazepine. And at the same time, Nexomica. These are the 4 medicines we can think in first by treating any cases of abdomen. These 4 medicines may give almost most of the complaints we can treat with these 4 medicines: Nexomica, Lycopodium, China, and carbamazepine. If the abdomen, there is, we know that belching and upper abdomen, carbamazepine, lower abdomen, Lycopodium, and whole abdomen, China. These are the 3 gas medicines. But at the same time, we can use the 3 medicines. At the same time, we can use for any complaints of the abdomen. Whole abdomen, we can use these medicines immediately or within some time, we may get a good result. So, a person having anorexia may be due to anorexia nervosa, anorexia due to hormonal imbalance. If one person having any mental problem or depression, that time anorexia nervosa. That time we should not think about the medicines we are using for the abdominal complaints. That time we may think about we have to reduce the if there is any depression. That time we may use Ignatia, Delphinium, Stramonium, and Nexomica. Nexomica for you can use, we can use it for nervous disorders as well as the anorexia nervosa. Then coming secrets your tongue reveals about your health. Fissures, abnormal smoothness, thick yellow coating, painless bumps, white creamy layer patches, bright redness, black and hairy tongue, sore tongues. Again, we can go first, fissures of the tongue, abnormal smoothness, thick yellow coating, painless bumps. That is dangerous. Painless bumps may be due to cancerous conditions. White and creamy layer patches, bright redness, black and hairy, sores. So we give, from today onwards, we have to check the tongue of each and every person with seriousness. Just don't, clean tongue, okay. Mapped tongue, okay. White tongue, okay. Anacardium, okay. Anticrude, okay. Antiptot, okay. Acid nitricum, okay. But there is a background. For if we are prescribing a medicine of acid nitricum, we have to think that there is a story behind the tongue. There is a story. There is a history. If a man becoming a tongue having if an acid nitricum tongue, we should not think that this is a present condition. There is a history of a past personality. In his personality, there is a history of becoming an acid nitricum personality. A person coming to us having a history of coming to lycopodium. That was a history of a person developing for years to become a lycopodium personality. That is how much importance to flora and the miasms. Okay, so this having all these tongues having a history, we should take the history. Then we reach here. We will reach here. Crosstalk between hormones and oral health in the midlife of women. Conclusion, hormones influence oral health by directly affecting the oral tissues as well as affecting a multitude of other bodies. This is the conclusion. Third time. What are the major signs of hormonal imbalance? Hormonal imbalance symptoms, menstrual changes. There are many reasons your monthly period can change, but hormonal imbalance often plays a role. Hair issues, hormones affect hairs, natural cycle and structure, skin problems, sex-related symptoms, weight changes, mood and sleep changes, tissues, the digestive stress. In ladies, before menstruation, 3 to 5 years, symptoms may develop. After menstruation, after menopausal, 3 to 5 years. Mood and sleep change. I think that many ladies may have sleeplessness. Very few persons having it. Maybe due to this other reason. How do you know if you have a hormonal imbalance in your mouth? How we can understand that there is a mouth? You may not notice any change in your mouth in the days before your period. In fact, most women don't. But if you have a swollen gums, bleeding gums, canker sores, or swollen salivary glands, hormone may be to blame. Note it. But if you have a swollen gums, bleeding gums, canker sores, or swollen salivary glands, hormones may be to blame. Otherwise, before that, no problem. After the periods, there is problem. Some girls having pimples during the time of menstruation. Before that, or sometime, there will not be a pimple. So, hormonal imbalance may be a reason. Geographic tongue. Oh. Lower level of estrogen, I told you that it may have bad smell. What vitamin deficiency causes bad taste in mouth? Bad taste in mouth. The deficiency of vitamin B12 has a clear effect on taste as it causes disruption in epithelial cells, producing tongue pain, redness of the tongue, and the absence of papilla, thereby increasing the taste. Vitamin C have a positive impact on the sense of taste. These are the two vitamins, vitamin B12 and vitamin C. Has a clear effect on taste as it causes disruption in epithelial cells. Muriatic acid, you know that muriatic acid? Muriatic acid has two areas very much affected. One, mouth and anus. Muriatic acid. Mouth and anus. These are the two soft parts. It's affected. Geographic tongue is where spots or patches appear on the top and sides of the tongue. The irregular patches make the tongue resemble a map, which why people call the condition geographic tongue. The patches result from a lack of papillae. The reason for mapping geographic tongue, lack of papillae or tiny bumps in the affected area. It is an often painless condition. It may be painless. We may think that the sore tongue, but it may be painless. Because there is loss of sensation is also another reason. Loss of sensation. That is why they don't have any pain. Often, the smooth patches will heal in one area of the tongue, then reappear in another area. In some cases, geographic tongue spots can appear in other areas of the mouth. Geographic tongue tends to affect middle-aged adults. However, it is not a common condition and there is no known cause. This article geographic tongue, how it diagnosed. Symptoms of geographic tongue. Geographic tongue in the symptoms are geographic tongue may be undetected for months or years. Often a dentist or condition during a routine oral examination. ചുമ്മാ നാക്കിങ്ങനെ ഇരിക്കും ചിലര് ജീവിതകാലം മൊത്തം I talk in Malayalam, sorry.
I think
Throughout the life.
yeah.
throughout the life, they may live like this. Whether I talked Malayalam anyway? Sorry. The condition causes smooth, red, and irregular patches on the top and sides of the tongue. Additional distinguishing features include patches in more than one area, raised border that can be white in color, patches of various sizes and shapes, patches that develop, heal, and migrate to different parts of the tongue over time, patches that change in size over time, patches that last up to a year at a time. I think that the time is passing, so I just go to the medicinal part. Arsenical. Mouth. Unhealthy, easily bleeding gums, ulceration of mouth with dryness and burning heat, epithelium of lip, tongue dry clean and red, stitching and burning pain in tongue, ulcerated with blue color, bloody, saliva, neuralgia of teeth, feel long and very sore, feel long, and muriatic acid, natrium, I think that natrium or muriatic acid there, also having long tongue, feeling of long tongue. Worse after midnight, better warmth, metallic taste, gulping of burning water. Then natrum muriaticum. Mouth, frothy, floating, tongue, scorbuticum, scurvy, numbness, tingling of tongue, lips and nose, vesicles and burning on tongue, as if there was a hair on it. Hairy sensation of the mouth. Eruptions around mouth and vesicles like pearls on lips and corneas of mouth, ulcerated and cracked, deep crack in middle of lower lip. Then mercurius, sweetish metallic taste, salivary secretions greatly increased, saliva more, bloody and viscid, saliva fitted, coppery, speech difficult on account of trembling tongue, gum spongy, resides, bleed easily, sore pain on touch from chewing, whole mouth moist, crown of teeth decay, tooth loss, feel tender and elongated, furrow in upper surface of the tongue, lengthwise, tongue heavy, thick, moist coating, yellow, flabby, teeth in dented, feels as if burnt with ulcers, feet ordered from mouth, and smell it all over the room. Alveolar abscess, worse at night, great thirst with moist mouth. Then lachesis, gum swollen, spongy. I told that for weak circulation. Tongue swollen, burns, trembling, red, dry, cracked at teeth, catches on teeth, abscess and denuted spots, black spots with burning and rawness. That means that blood, dead tissues, nauseous taste, teeth ache, pain, extends to ears, pain in facial bones. Then another nitric acid. Putrid mouth, breath, salivation, bleeding of gums, painful pimples on the sides of the tongue clean, red and wet with center furrow. Teeth become loose, gums soft and spongy, ulcers in soft palate, sharp splinter-like pains, salivation and fit orange blood in taste. Most of the medicines, these are the medicines we can use in the later life of our later life. Then comes phytolacca. Mouth, teething children with irresistible desire to bite the teeth together. Teeth clenched, lower lip round-like, lips everted, jaws firmly, chin round and sternum, tongue red tip. Feels rough and scald, bleeding from mouth, blisters on side, mapped tongue, fissured with yellow patch down center, much stringy saliva. This is the medicine, phytolacca. And the last medicine I am telling you, muriatic acid. Tongue pain, swollen, leathery, paralyzed, deep ulcers on tongue, hard lumps in tongue, epithelioma, exclusion, aphthous mouth, gums and glands swollen, sores on tongue. Because I am going medicine very speedily, because everybody knows it. So all doctors, you know, so I am not going through it. So thank you very much for giving me a chance. Thank you, Doctor. Doctor. Anjali Maliakal. Because calling you Anjali by Sahani sir, I am also doing the same thing.
Most of the people they are calling me, mostly in Hindi people, they call me as Anjali.
Anjali, it is a good name.
Yeah.
So I am
And
also pronounced like it. Thank you, doctor. Thank you.
here also many people like Sindhi, they are calling me Anjani.
Okay. Thank you very much.
Okay, thank you, sir. It was wonderful presentation. Actually, your slides presentation, it was very clear and useful also. Thank you so much for making this much effort to explain about the tongue. Actually, tongue is a wide part. I mean, that tongue needs wide explanation. You have done it. Good job. And we have 6 more minutes. If anyone have questions, you can raise your hand and ask question. Yeah, Dr. Indranil, please.
Yeah,
You can
thanks,
unmute.
madam. Yeah, thanks, madam, for allowing the question. Sir, in the mouth symptoms, like we have seen, most of the time polycrest are indicated and the acid group. Can you label some of the short-acting remedies for mouth complaints, like common mouth complaints like ulcers, burning, dry mouth? Are there any short remedies for it?
Short remedies, I am always going to polycrest. After that only after using polycrest, then only the third option will be a small medicine.
Okay.
Hydrastics we can use. Hydrastics. Hydrastics.
Many times, sir, what happens, like we get the mouth symptoms and homeopaths keep on probing the patient, asking him physical generals to get more characteristic symptoms, and then they select the polycrest. And sometimes it works, sometimes it doesn't work. that is there. That is there. One more question. Is there any specific medicine for scarring of tongue?
Scarring of tongue? No. I don't have much experience.
Okay. Because this rarely it is seen, but it is seen in chronic ulcers. Exactly. Okay, sir. Yeah.
Thank you, doctor, for asking.
Thank you, Dr. Indranil. And anyone else have questions? Please, you can ask. And Dr. Ram Parvesh Shah, sir, is about to say his opinion. You can say.
Oh.
You can unmute yourself.
Yeah.
Thank you, Dr. Anjali. Namaskar, Dr. Mansoorji and Indraji. And thank you, Dr. Hubert Salwa. Heartfelt thanks. to Dr. Hubert guidance. Level guidance, endocrinological insight and hormones present in the tongue. Your support is the really appreciated. Very, very thanks. And hormones, really, hormones affecting tongue. And hormones affect due to electrical disbalance. Electrical disbalance after affect hormones, chemical disbalance, and sign and symptom in map-like symptom in tongue. So very, very thanks, Dr. Silva. Thank you.
Thank you so much, Ram Parvesha sir. And now I think no one else has asked question. So we'll move to, we'll hand over the session to Manoj Doctor, because we have a special day today in Malayalam session. And thank you all the participants for being with us, and let's continue our journey, the journey of success together. Thank you so much. Good night, everyone. See you the same time tomorrow. Thank you and love you all. And I'm welcoming Dr. Manoj for moderating Malayalam session. Sir, you can take.
Thank you.